Good evening, everyone. We're calling the meeting to order. This is the general meeting of the HLG for April. As you know, we have a general meeting every other month, so we're really thankful to those of you who were able to attend. We're always glad to see all of you. And today we have a special speaker, that is Dr. Wyndham. She is with Simon Center, the PCAD department. And I'm going to turn on the microphone over to her so that she can get started with the presentation. Thank you, Dr. Wyndham, for being here today.
Thank you, everyone who allowed me to come and speak. I'm very happy on behalf of PCAD.
Oh, never mind. Oh, there we go. Yep. Oh, I'm sorry. Oh, I guess it won't let me. I'm sorry.
Thank you, everyone. On behalf of the Program for the Elimination of Cancer Disparities, I'm very happy to be here amongst you all here at the Hispanic Leaders Group. I love doing what I do, and special thanks to Ms. Yvonne Berlinger for inviting me. Greatly appreciated. So on the first screen, you will see a picture of me, myself, Dr. Bettina Drake. And so I'm on the cover screen. You see pictures of me, Dr. Bettina Drake, and Dr. Lannis Hall. We are part of the Program for the Elimination of Cancer Disparities, PCAD. So what is PCAD? It is the Community Outreach and Engagement Division of Simon Cancer Center. Our goal is to ensure that all cancer patients in communities benefit from the clinical and scientific advances to reduce cancer burdens and related disparities while engaging in communities to promote health equity. What are our main priorities? Our priorities are to accelerate outreach, education, and access to clinical resources in Simon catchment areas. And when we talk about catchment areas, that comprises of 82 counties, 42 counties on the Missouri side and 40 counties on the Illinois side. We also strive to evaluate the cancer burden and related disparities in Simon catchment populations. Our goal also is to foster research and promote diverse participation in clinical trials. And we also would like to evaluate community engagement and progress towards achieving these goals. The demographics for our catchment population is very large. Our total population for Simon Cancer Center, what we serve, is 4.8 million individuals. And this is divided up with minority race ethnicity populations, which represent 25% of that total population. We have residents in rural areas that make up 17.4%. And then we also have residents residing in medically underserved areas, also known as the MUAs, that represent 37.3%. I want to note really quick right here. In 2021, Simon Cancer Center served approximately 9,200 patients, including 15.5 being minority, 13% being rural, and 27% being medically underserved areas. Now I should turn to the Hispanic demographics. Now, from this perspective, with Hispanics in St. Louis City, the cancer incident rates were 57% lower than the national average, meaning that the national average was 195.6 versus 346.5, which is the national average, but the mortality rate were 22% higher, which is 112.2 average versus 92.1, which is the national number. I also displayed the counties and their average incidence. So as you look at the table, McDonald had a total of 712.6, Pettis County had 409.3, Jackson had 304.8, St. Louis City 195.5, and St. Louis County 112.2. To address the council burden here in St. Louis and across our 82 county region, we recognize the importance of having advisory boards and partnerships. Our first board consists of the Disparities Elimination Advisory Committee, also known as DAC. We have 2 Hispanic representatives that serve on that board, Ms. Yvonne Berlinger and Mr. Sal Valadez. The purpose of this board is for them to assimilate together quarterly to review PCAD outreach activities and provide suggestions. They also recommend information like making sure that PCAD provide culturally appropriate materials for our population. As we noticed, St. Louis has a melting pot of different populations, which also comprises the Hispanic community, and also providing recommendations on how we should carry out outreach in those communities. We recognize the importance of disseminating language-friendly information to all of our international communities. Aside from our board, we also have 3 cancer-focused populations or partnerships. The first one is the Breast Cancer Community Partnership, also known as BCAP. BCAP focus is to address the cancer burden in the greater St. Louis area. Some of their opportunities consist of promoting breast cancer screening through our sight-line mammography ban, getting women enrolled in the Show Me Healthy Women program, and also encouraging women who are uninsured or underinsured to keep up to track with their mammography screenings. The next cancer focus group is the Prostate Cancer Community Partnership, also known as the PCCP. The Prostate Cancer Community Partnership focuses on addressing cancer burdens in the greater St. Louis area. This group consists of prostate cancer survivors, clinicians of Sight Cancer Center, faculty members of Washington University School of Medicine, and advocates. They also meet monthly to discuss the burden of prostate cancer and how we can incorporate more with prostate cancer screening and education. Lastly, we have the Colorectal Cancer Community Partnership, which also meets quarterly like DEEC. This group consists of faculty members from WashU, BJC, BJH. It also consists of advocates, caregivers, and survivors. They all meet together to discuss the burden of colorectal cancer and encourage screening. What's unique about this group is they just recently initiated the fecal immunochemical test, also known as the FIT test, to provide screening in underserved areas here in St. Louis. PCAD is also known for its state level work. We've done a lot of great things through the Missouri Cancer Consortium. The consortium comprises of state level and local level organizations that come together to address the cancer burden across the state of Missouri. This group stems from the Missouri Department of Health and Senior Services, and they meet monthly to strategize on ways of how to reduce the economic burden of fellow Missourians when they're out, trying to find ways to get screening. My colleague, Dr. Sarah Chavez, she heads this group. She serves as the co-chair, and she has done a lot of great work by incorporating a lot of the screenings, like the colorectal cancer FIT test through the state employees health screening, and other initiatives to encourage individuals to get screened. This consortium also includes the HPV work group that's a part of Missouri, the Missouri Radon group under the Lung Cancer Coalition. Each group is focusing on its own cancer focus to encourage screening across the state of Missouri. One of the things that PCAT is known for, if we're out in the community, is our outreach and educational materials. We do that through our 8 ways to prevent cancer. These tools provide simple 8 steps for individuals to reduce their risk of developing cancer. Although we can't control the genetics, we can provide these simple steps to you on how to reduce your risk and what to watch out for. Some of these steps also include maintaining a healthy weight, avoid smoking, limit your alcohol intake or don't drink alcohol at all, get screened for all STIs, and also getting vaccinated for HPV. When we came out with these tools, they were originally set up in English, but we felt like since we were wanting to extend to the national community, we developed more of these 8 ways in different languages. Those languages include Vietnamese, Bosnian, and Spanish. We're in the process at this point of updating our Spanish materials to make sure they are properly read throughout the community. And we would love for your help here to disseminate these materials to our communities. We also have the Native American 8 ways. It's basically tailored to the Native American population and American Indian population here in St. Louis. We look forward to sharing those tools and all those resources coming up this month at the Catherine M. Buddha Center, where they're having their annual powwow. Since the pandemic, there haven't been a lot of action with this group, but we are excited and ecstatic to come back and provide our information and encourage the screening. You can also catch the Simon mammography van there as well. PCAT also has different resource guides. We have the prostate, colon, and breast guides. Each guide provides information on the signs and symptoms of the cancers, where individuals can go to receive treatment. It also provides other information like Meals on Wheels and different support groups across the greater St. Louis region. We're currently updating our resource guides because our organizations and our cancer focus has extended to various organizations. So we definitely are proud and want to include them in our guides. PCAT also has signature events. One of our famous events is the Smart Health event. It is a community health education day that allows community members to come and learn about the most recent updates with cancer, how to get screened, and then there's a segment where they can ask the physicians and clinicians who are presenting different types of questions in terms of screening and education. We also provide entertainment at the event. Our prostate cancer community partnership, we also work with them at community outreach events to provide free prostate-specific antigen and colon cancer screenings. The prostate-specific antigen is a simple blood draw, and it's out for men ages 40s and older who would like to get tested for prostate cancer. It only takes about 10 minutes, and then once they get tested, they receive the results within 2 to 3 weeks. As I mentioned, the colon cancer fit test is just a stool test. Individuals can take a sample of their stool while they're passing the bowel movement and put the stool sample into their solution and mail it back to our designated labs. So I guess you're wondering why we are here. What are our goals? Well, it's simple. Our goals are to work with the Hispanic leadership group and other communities to provide culturally appropriate materials about cancer screenings. We also would like to serve as a conduit to underserved individuals within the Hispanic community. Case in point, as a coordinator, I have the pleasure of working with 2 community health workers who are now facing the issue of working with 2 women who are undocumented here. We recognize that most undocumented individuals, they don't receive the same care as those who are natural citizens here. There are definitely more than likely to be uninsured. So we would like to work with these organizations to provide resources to individuals so they can get free screenings. We know that our hospital systems provide funding and through foundations to help individuals who are undocumented so they can get the treatment that they need. And we would also like to work with you all to develop quality programming that focus specifically on the disparities within the Hispanic community. At this point, I would like to turn to questions, but I would like to leave with a saying that you probably are already familiar with. Ayúdame a ayudarte, por favor. Help me so I can help you, please. Any questions?
Hi, I'm Karen Rasmussen. I'm with St. Louis County. I'm curious, I mean, in Black and brown communities before the pandemic, there was certainly a high level of distrust of not only government institutions, but medical institutions as well. And I don't think it's gotten any easier. Has there been a shift since the pandemic? Has there been a shift in your ability to go out in the communities with different strategies to try and have these conversations in a different way? Or is it really just about people talking to people? No special strategy at all, it's just you.
That's a good question. One of the things that I try to tell my team is to have a candid conversation. Be open. We don't approach anyone as if we're clinicians. Although I'm a social scientist by trade, I don't force anyone to be bombarded with a lot of different technical terms. I come to them and say, hey, this is about you getting the proper screening. Too many of us, and I speak from an African American perspective, too many of us are dying out here in the community. You should go ahead and get tested for whatever cancer at that time I'm encouraging for individuals to get screened. I have a conversation, I approach couples, and I'm like, if it's a woman with her husband, I'm like, excuse me, ma'am, can I talk to your husband about prostate cancer? Excuse me, sir, can you pass this flyer to your wife? You know, we're doing free mammography screening. And it's just a matter of having a straightforward conversation. One of the things I would recommend for people is to build a strong relationship. I think with us, and I'm speaking again from an African American perspective, we have strong ties with the church. So getting to know your event organizer, who's more than likely to be a part of the church, establishing that relationship and asking their input and how familiar they are with cancer and cancer burden and cancer screenings. And so we try to educate them before the event, and then we try to spread the word. We go to different venues and try to have a conversation with people. At this point, like my community health worker, we've gone to like night venues to have a conversation. We've asked the night club owner, can we have a talk for a second about cancer screenings? And they've allowed us to come in that venue freely.
Can I just ask a follow-up? How did you get into doing this work?
It's funny. Well, I would say you have to be careful what you pray for, honestly. My mother passed away of stage 4 lung cancer. I actually had 2 deaths. Like, she passed away July 15th of lung cancer. My grandmother, her mother, passed away 2 days prior with breast cancer. So it was just kind of a calling, because I was like, God help me to help others who are going through cancer. I don't want to see a person to just transition like this.
Thank you. I'm sorry.
If you would mind, I would like to have some of that information available for my clients, for my employees, I should say, I'm sorry. They are low income. There's a stigma of, well, I'm this, I'm that, so I can't afford to go get tested, or I don't know where to go if this situation happens. So if there's a, we, at my office, we love to be able to help those that are in our office. We have a wall for clothing for people who need clothing. We feed them there as well. But it's just a matter of making people feel that they're not being belittled, and they're, they have some self-worth. So when they do go out into the workforce, they're ready. They feel like someone gave us an opportunity. And so there's a resource book that we use if they're in need of utility assistance or food. But if that information you have, I'd be more than happy to post it on our walls here to help get out the community. Because in our office, we have a variety of different folks that come in. So different nationalities, different things. We'd be more than happy to put that up there.
Absolutely. I'll be more than happy to provide that information, because the more information we disseminate, the more we'll have people coming in to get the screenings that they need. Because what you're doing is great work, because that social determinants of health is very important. And we try to meet people where they are. I realized doing this type of work, I have excellent community health workers who try to help individuals in the process, because it's not always about cancer screening. It's also about who's going to look after my children. How will I make it through the day? How can I pay my bills? Those are very important questions. So cancer screening is kind of left on the side, but I've learned until we meet those needs and those hierarchy of needs, we're able to have a better chance of getting people to come to the doctor and get screened. Ms. Yvonne?
A lot of people are afraid to get screened because they're afraid of the procedure. They think, well, what does this mean? Will this hurt? That's one group of people. Other people are afraid to be screened because they think they're going to get bad news. The Simon Center have a resource where somebody could call in, and especially if they don't speak English, but even if it's just in English, and just have those kinds of questions answered.
That's a good question. One of the hotlines that you can use is the Patient Care Coordinator System, PCCC. They are supposed to answer those questions about screening and how it works. Even if you call us at PCAD, we have no problem walking you through the process of how screening works. Because as you know, some women, they're afraid to get a mammogram. We can tell them, and I had my first mammogram this year. We can talk to them about what it's like, what can be done. We also utilize the BJC navigators that are a part of our cancer community partnership to talk to people, to put them at ease about it. So it's kind of more of a bilateral approach. We work with our navigators at the Breast Health Center to talk to people about mammography screening and things of that nature.
And are those phone numbers, like where to call for questions in your website or in the brochures, both?
It's on the brochures, and then also I can, if it's direct for a navigator, I can provide you the information of who's a great navigator. So definitely that.
Thank you.
Dr. Keisha, I would like to commend you on a couple of things that I heard. I think your boots on the ground effort, I think, is a great avenue for connecting with audiences of color. Because in my work with the Alzheimer's Association, one thing I learned was people will typically not approach you to tell you that they had Alzheimer's. You approach them and engage them in a conversation, and maybe then, once they felt comfortable with you, they may disclose it, because it's such a sensitive topic. And so oftentimes you would require that intimate conversation with them. So that's amazing that you and your team are leading those efforts. And then number two, language access is so important for our community. And so the fact that you are conscious of making sure that you have a language appropriate resources is amazing.
Thank you so much. It's more work to be done, because I think the good news is I'm partnering with Ms. Berlinger, and we're working and we're striving to make sure that all of our materials, not just the brochures, but everything, all of our webinar events are translated in Spanish or some other language. We really want to be an asset to you all, and we really want to get the message out there about the importance of cancer screening.
But Doctor, I think you also have questions for our audience that you wanted to ask, if it's okay for our group. That Dr. Wyndham directs some questions. She wanted a brainstorming session with us.
Can you repeat the question? We cannot hear.
Oh, okay, I'm sorry. My voice is really small.
that Dr. Wyndham has some questions for us as an audience
Okay,
as well. She'd like to get our input
okay.
to improve the connection with the Hispanic community. Okay, Dr. Wyndham.
Sounds great.
So I have an observation, you know, if I have a doctorate or I'm in a county or a town, I had Latinos ask me that they want something that looks like them. That's that job, you know, so then that's the extra step in trusting the system or, you know, engaging with you, you know, if something is engaging with their families at events and they see you're at the church or the YMCA or local library and they see you around, so you must be a good person, you know? So that's the first thing I've seen, but like I've also seen the disparities in the actual, when the professionals are not what they're looking, oh, they don't look like me, so I just can't trust them completely, or the language barrier, I know that could be solved, you know, they have the translation services, but I've dealt with a lot of multi-state things with the, where, you know, in Illinois, clients, if they cross river to use the testing, right? The different standards, you know, so there's a lot of confusion. So my thing is, how do we get more people to say, hey, you know, it's, like I say, I just learned a lot. It doesn't take that much time. It's like you go in, get the check, you're done, you know, and you get your results. And what's the follow-up like with the partnership look like?
In terms of, like, joining,
No, like successful story, you know, what is one family, what does it look like?
oh,
That's what I meant, like, you know, someone does the program,
oh,
how does it, you know, they're,
what are the successes for some of the people that we screened?
Yeah.
That's, okay. Well, I would say this, when we implemented our fit test screening, a lot of people, Black and brown people, were afraid of fit tests and colonoscopy. Because once you get the fit is just the initial test. If it's negative, you're okay. You can go come back the next year and get another test. But if it's positive, you do have to come in and have to schedule with your primary care physician to get a colonoscopy.
That potentially means missing work, right? I mean,
Right.
for some people,
That's a barrier.
The bigger question, and like on my side would be, so let's say Joe comes in and gets tested.
Mhm.
Then he comes back saying, hey, I've got to come back and I came positive. First thing that's coming to mind is, forget it, I can't pay for it.
Right.
I can't afford this.
Right.
I'm just gonna work until, and the mentality is, I'm just gonna work until I die about this. You know, and I'll try to make sure that I can get my family taken care of. But if they don't see, and the reality is, mostly, I know a lot, I'll be honest, I know a lot of Hispanics out here that I work with and I know of, that they worked 18, 20, 30 years have been out here. And many of them, when the pandemic happened, not having qualified for unemployment, many of them don't apply for benefits, and they can't afford health insurance. So if, you know, like I said, I'd be more than happy to put this in my office, because I'm for this. I'm more than happy to help out with what I can, because everybody's human. And so if I'm able to, and if that's the biggest thing is, just having an answer is, how can I afford this? And that's really the biggest hurdle. If that person does come back with this is, well, this is what, you can go to this place, or you can go to contact them, and this is what that's going to be.
well, and so if people are on Medicaid, does Medicaid cover preventative screening?
But not for those that are not documented.
So, it does, and you correct me on this, it does cover for those who had procedures done, like, I think it's the retroactive procedure. If you had a procedure or you were scheduled for a procedure prior to being enrolled into Medicaid,
Right.
it will cover that, but not
After 30 days.
after 30 days.
Okay.
But if they're,
Yeah,
but if a person is undocumented and there's no resource for payment, do we go back to square one?
That's a good
See what I
question.
mean?
So what I would say is that the Orange Jewish Hospital, it does have a fund that cover documented workers, the undocumented
Okay.
workers.
Do they cover everything?
Or they have a limit?
That's a good question. I wouldn't say they cover everything, but I think they cover probably up to a certain percentage, but that's something I can follow up with.
Somebody told me she owed about 20,000, I believe, in Medicaid, and she's undocumented. So I went to the website, I saw an application, I sent it to her. So I don't know if she has submitted it, or if she submitted it already, or what.
In my previous experience, I was a senior appeal set for a big money guys. What we used to tell people were those who could not, we're looking at $1 million bills. They gone through because of cancer, they came back, regret, and it's their insurance is 8%. And even those who have insurance. So what we used to tell them is, please apply, provide all the all the financial, and provide, if necessary, the medical that's going to help with this process with your doctor. And there's some that have not had any insurance. Some of them were forgiven for 100%. Others were at 50%. It just depends. But if it's 50% is even better than you're still left with a substantial amount.
Right.
And you can still reapply later. But again, people don't know if there's no one there to speak to them.
This just came in. So if you're not Latino, but also you're afraid of you have an existing condition right after you've done the test, right? And all of a sudden, employer might, how did you find that out, right? Because I've heard of, I don't know, rumors or stories that pre-existing conditions, right? That's why a lot of people don't want to do these tests that I've asked, because they don't know if it's sold
No, but
information.
you have to make sure people understand, under what used to be called Obamacare,
Yeah,
you're still covered if you have pre-existing.
Right.
so that's the
Make sure
misconception,
people
they don't understand that.
That has to be, unfortunately, people really don't understand that, and that has to be screened again and again and again and again.
Because I've had friends that said that they're not getting insured anymore because the insurance company somehow knows they got
No,
something,
it's a
or
different
that they
reason.
was somebody sold the information.
But was it in the marketplace that you mentioned, or was it with their private insurance? Because it depends on the different insurances they want to do, but if they go out into the marketplace.
It's called the marketplace.
Right, marketplace along here.
So I'm just talking like that, kind of ignorant, wanted to know, because that's what I hear from community people, not just Latino, like, they're like afraid to do some tests because all of a sudden now, in the future, now I can't get some
I mean,
coverage or
that's
something.
That's the real challenge.
Yeah,
Is
so-
Your approach to create trust. I mean.
So here are different things. Here's, trust issues, that's what I'm hearing. And then I'm hearing, misinformation or lack of information.
Yeah, and, Martha had some questions.
My name is Marta Castellanos. I did my last MRI in 2019, 2020, 2021. I was afraid to go to the hospital to do it because of the pandemic. And then 2022, I had an appointment and I had to change it fast because I felt something in my breast. And I told them to change my appointment because I was going to visit my family that I didn't see for 5 years. So I said to the doctor, whatever you're going to do, it has to be 2023. So if you did mammogram, you have to come back. If we find something, you have to come back. We have to do the. And then that's when they told me I had cancer. That's a big word. When they tell you cancer, you hear everything goes like, wait a minute, you know? So, well, thank God, the doctor said I did it in time. My cancer was on the O, and it was spread. So to me, it was, my last radiation was, I didn't know chemo, but my last radiation was last month. This one. The thing that we have to make sure is because they do it free in YMCA without work. And then we have to let people know that they have to do that test because it's very important to catch in time, to save your life, you know? But to me, it was too much, and I just went depressed, and I'm trying to keep going, and some people that I was strong for hours, you know, inside, they can do better.
So the emotional support
See,
is
but I have good friends,
She
in that.
has emotional support a lot. She
I
has
got
very
good friends in
many
church, and
the church and friends and family.
and they got today because I don't want no family, I don't want no
And
sister.
some people don't have that because they're immigrants.
Well,
and
I
they-
have, you see these two ladies here? Call me every day. A lot of people worry about me in church, they pray, and I didn't tell nobody in YMCA because I didn't want them to say, oh, Miss Martha might die. Because I got a lot of kids, they love me, and I think, yeah, that's what I do, because that's made me happy to do that, work with the kids. So it was to me like, I'm here, I'm suffering for this, but I'm here, you know? And the doctor said, you can do it, I like your attitude, and that. So I'm here.
I want to add something about Marta. She is a very strong person and she believes in God, and God is in her life and everything she does. Marta is not alone because God and friends and family we are with her. Besides that, she was very brave and she explained only a few people what she has. She doesn't want a lot of people concerned and worry about her. She wants only to be cured and she wants to go through this program, and thank you God, it was successful. But I have a question for Marta. You said the test is free in YMCA. What test are you talking about? Oh, the
I don't know.
mammogram.
I look at her
Thank you.
because they're gonna have next to us.
Thank you,
They're
thank
gonna
you.
have, what is that you're gonna have?
We're gonna have the health
A
center.
opinion, a health center.
Healthcare support.
So the people was complaining,
Oh,
and I
this
said,
one?
is
Oh,
this
this
one
one.
to change? Yeah. Or any days you have to do it. But I said to the people, people want to say, I said, you guys gonna be happy because we're gonna have a health center here.
Might as well use it.
And the Simon Cancer Center is going to also come once we
All
schedule
right.
it to have the mammography and healthcare at the site. We already have, they already come. We
Okay,
already have
next
a
door.
partnership.
And for how long? You say time limits? For how long they are going to have these 3 tests and mammograms?
We work on schedules for leukemia and different federally qualified health centers in St. Louis.
All
So
they,
it's on.
they have to quite.
Different months,
Different months.
different weeks or months, whenever they come. There's a schedule.
I just have one thing let me say. I grew up here, and so I know I don't have an accent like this. The population of Hispanics is growing. We're not California, we're not Phoenix, we're not Chicago, you know, we're not Florida. I remember coming, when I got here, when my father relocated to the business, 1978. So I spent well over almost 40 years here. Going to high school, I was not perfect. So I got in trouble. You could hear Gonzalez over the intercom. When I went to high school, there was only this many Hispanics in high school. Well, those were my sister, which I didn't understand. But I attended Roosevelt for my freshman year. Then I attended Management Law, Public Policy, and then Central Division of Performing Arts. It's growing. But the problem is there, and some of the things that's growing is that there's not someone out there to, we're not selling, we're not out there to recommend, we're just out there to educate and let someone know. And regardless of race or what it may be, there's a different culture of Hispanics because I grew up when it was a large amount of Cubans over here. And then all of a sudden it was Vietnamese, then it was Boston, so it was this. So everything Cherokee was not Cherokee.
Right.
And so there's a lot of change, but now it's just a matter of, sometimes we just need to take a moment of our step and take maybe 10, 15 minutes and let a person, because if you educate one person properly with who, what, and where, oh, well, if you, and you listen to your aunt or your cousin, hey, they sit around a table, drink a little coffee, and they're talking about, I feel this, all you have to say without being too detailed, they're gonna be doing some testing down there. Yeah, just go down there, it's free. You say free, they're gonna.
I prefer to professionals in legal, it could be doctors, but I'm prospecting these professionals, and what's happened, they've been really good to talk, but when I actually sent the client to that person, it wasn't the result I want. So I take a step back to take a step forward, and man, I thought this was a great program that helps you, So it's that trust, I'm getting back to that trust thing, because I'm kind of like in the middle. I want to step away, I want to make sure you're connected with the resources and that you're private, that I know this person, this hospital, this law firm, they know me personally, but then the handoff is a very personal thing. Like I had a friend from Colombia that brought his wife because now they could get the drugs they need for a beer, because they didn't know about the programs. But if not, he was probably gonna leave and go back because in Colombia it's easier to get the drugs for his wife. So, but me connecting him with the right, people, I make sure when I talk to the professional, I make sure I get to know you, be like, I know you're really good, and because that's been my experience living in St. Louis 20 years. There's a lot of people with the titles that have not, especially in immigration law, I would say, I can say there's I always now give for immigration lawyers, because if I like the one that's really outgoing, maybe that's the one that's not going to do the best job. And that's been and it comes back to me because I want to make sure if it's health, it's very important that they get I get my education, I know the basics of the program, and now I know it's a trustworthy program, it's not somebody off the street. Then once I hand it off, I got to make sure.
If I may.
Yeah.
I don't mean to overstep words, what I'm saying. Sometimes, and the reality of the thing is, not everything's going to be a perfect world. And the part is, if they don't do their part, you've done all your thing.
Yeah.
And if that person doesn't move forward and follow up on their cause, and that's where I've come to. Some of the people, they want you to do everything for them. And that's where I come into the problem is, I've given you everything that I have of all the information. It's your part to do your part. You got to call, you got to follow up their appointments, and not everything, you still got a life that you got to fulfill. What I do is I focus on others that is going to go forward and use that opportunity while the resources that I've given you to go forward.
I have a question.
Yes, ma'am.
In your line of work, based on what you're saying, you do a lot of social service work, and you do a lot of advocating, making sure people meet, meet these resources. Have you ever come across any community health workers that are in your community that can help navigate people through the system?
I have, funny you said, my uncle is a social worker. I make fun of him for being a social worker. It's personal, it's for fun, but it's like my brother. I have friends who were with the other organization, which is People's. They're friends. And I have other friends who are social workers as well. And they send me people. And it's not just because I need employees. That's not the case. If you need a job to get you through, help you pay your rent for the next day, your light's about to get continued, whatever it may be, that's what I'm here for at the moment. And so at the same time, the girls in the office, hey, if you need something with food, if you're hungry, if you got a kid, we got dogs rolling on the road. Or if you need something else, there's a book that you can take with you. It's a blue book with a bunch of resources in there. Call them. I can't fix everything, but I can help put a little Band-Aid on there for a moment. And that's all I can do. But the biggest thing is, is if we're able to give information, it's now up to them to make the phone call and to do the follow-up. Because I haven't been on those. It's trying to tell.
One number, and then nobody else. So this.
And I asked it, because I know as social media.
Yeah.
And oftentimes social media are inundated with different cases, but I think with the role of community health worker is strong because actually the boots on the ground. They're going to places in social media time and they're trying to figure out what's going on. You have community health workers in Kenya and different places where they are able to talk to the clinicians and say, this is the reason why he's not or she's not following up because she has other issues, she has transportation issues, she's unable to find a babysitter.
You know, you gotta build trust, because if I go knocking on your door, I don't know you, I'm not opening my door.
Right.
You know, it's a matter of, it starts with the schools. My uncle works with the schools to let people know, hey, we're doing this. I sometimes send over flyers, hey, we're helping you for this position, if you guys are pursuing that.
I've had trouble with getting the appointment because they don't have documents, so only their children get the benefit of ride share or those pickups to medical appointments. They didn't even know about that, and I just Googled it, and it came up in Spanish, and I showed them. But the mom needed the service, and not the kid, you know, so for me, as someone trying to find resources for them to get them to the appointment, get them to the, you know, the help, you know, because they either don't have transportation or something. Like I said, we got a limited side, you know, I can give you a ride here once in a while, I can't be there all the time.
But unfortunately, all the rides will be canceled on
Navigation is really a big thing that people, like, as you hear, everybody here helps somebody else navigate, but that's because we know somebody. But, you know, a lot of people might see like a Cycling Cancer Center, and they know what it is up there, but they don't know what they need to do next. Like, when they need to make a phone call, when they need to have insurance firms, and they call, if they have those insurance, like, what happens next, you know, so I think, having that really, prominent and well established, so that people know, kind of like, this is where I can get information and help, not just information, but navigation kind of help. I think that goes a long way, you know, that's for everybody, whether it's a science center, city health, you know, or the legal resources and everybody, you know, it's just, people are struggling, you know, whether they're immigrants or they're born here. And, you know, they're second generation or, you know, whatever, they just, maybe haven't encountered this situation before. They haven't learned from somebody else. But they don't have, you know, they're not as resourceful as gentlemen that have been speaking. Which, I gotta say, kudos to all the gentlemen here today. Because in healthcare, we see that the women take a lot better care of themselves, and the gentlemen kind of like, well, I'm kind of tough, I may not need this, you know. So, kudos to you for also caring for others. It's you on Facebook, I think is.
I deactivated, I can reactivate it. Oh, this one.
Well, not you personally, but that
We do.
so we could put that, we should put that on the Facebook. Are you doing that?
No, that's the communications.
Yeah, are you doing that? So we should put the Facebook page up and spread the word on that, and how it's, I know we have Instagram, we should figure out a way to socialize it, because that's one way to sort of vote an endorsement of spread the word. At least all need to take advantage of themselves.
I have a question, so is social media popular among the population? Very popular.
Depends on what age bracket you're speaking of.
Yeah, I mean, if you do Mexicanos and St. Louis, everything they post there, people get like TikToks, they get shopping stuff. That's one example where people get their media.
And if you are putting your mobile things together, or your online things together, because the Hispanic community generally does things on their phone, less on a desktop. Everything has to be able to be accessible with WhatsApp. All the click-throughs need to be mobile.
So
WhatsApp. Right, exactly, mobile phone, and not just desktop.
another area I've noticed, the bi-state area that we live in has come, there's a lot more Latinos on the west side, Vermont areas. What happens is they ask me, like, the state of Illinois has really good progressive stuff they offer. They call Springfield, they got a Spanish speaker, and they call me because the county person does not speak Spanish. So there's a disconnect with they're supposed to offer a statewide service and they have a Prima Zero para Español. You do that, you get the initial connection, then they get frustrated because the local person doesn't. It's very common, even, I see it all the time.
What's funny is, when my wife does this translation for Spanish, their Spanish is worse than mine. For the translation. I'm like, good Lord, I know my Spanish is not perfect by no means, but oh my God, this is, I'm like, okay. To me, I've not been in the Hispanic culture my entire life, as you know. But I mean, I have family in Texas and I've gone to Mexico back and forth, everything else on vacation. But it wasn't until I got married about 5 years ago that it was, I didn't know what, a lot of stuff was and everything else. And she's done better cruise. And I'll be honest, normally I don't go out and speak so much about this, but undocumented, and I never would have thought that I would have, felt for a person, no by any means. And for me, that really did tip me off in trying to go out there and help people more, because during that time frame, they're working their butts off. So many cases that I had to represent, and I'm not an attorney, but I asked the friends who were judges down at City Hall if they can allow me to represent them by just translating. And to let them know this is what they're going to want to do, this is what they're going to do, to the point where I was getting calls from the judges saying, hey, can you do me a favor? I get a ticket. No. But it's the fact is there's a lot of it that's out there that it's not known. They're afraid because there's no resources for them. There's no nothing.
Do you have any flyers or any information with you that we can go home and thank you very much. Thank you.
The other thing I have to say is,
There's a Spanish in Spanish.
we are in the process of
Thank you, Ben. Thank you. Thank
When
you.
the flyers are updated in Spanish, Dr. Benton is gonna send
No
me.
te oigo bien.
Oh, sorry, when the flyers are translated into Spanish, Dr. Benton is gonna send me a little bundle, and then I can distribute it to the Hispanic leaders. But they're in the process of making changes.
I'll take that
don't
one.
mean to sound stereotypical, but there is a definite correlation between communities. To get to the National Restaurant Owners Association, we have so many of the Mexican community who work in restaurants. Mexican community. And I became aware that, at least in that aspect of the Mexicans, I think it's the largest population of people who speak Spanish. The National Restaurant Association would be a huge contact. And the other would be if there is, again, I don't mean to stereotype, that's not what I do. The reality is the folks who run landscaping. So many, and they are undocumented folks, but they're also folks who work who are economically disadvantaged too.
Again, I'm wondering if maybe going for the Hispanic chamber.
Oh, well, the Hispanic chamber in a heartbeat, and the other thing too, when everybody, the Hispanic chamber, the Asian chamber.
Yeah, and the chambers, yeah, reach those different types of jobs.
Well, and the Asian community too, I know that the Asian community is kind of in the same boat as a matter of trust, maybe not. I don't know if the same.
Bilingual International hosts a lot of smaller group sessions and they've invited various nonprofits.
Yeah, and also maybe human trafficking. One of my people was exploited in issues who don't have benefits, and human trafficking. It's probably the same, but people said, I don't know.
It is.
Yeah, I mean, the numbers a few years ago, were the next few years, roughly 40% were in the restaurant industry and 40% were in the landscape. I I think that's what, I mean, I don't know, everyone's stereotypes, but there could still, and maybe the regional chamber, like the general chamber will continue to say they are aware of that, and I would enlist the regional business council too. The regional chamber that I believe is able. Most of them, I mean, most of them are very white, but most of them are going to be able to find those.
There's also that the churches that are pretty large.
Well, the churches are, and they have, would they?
No.
Cecilia,
Okay.
and in West County, there's.
The archdiocese has a list of all of the, Spanish.
Actually, you know what, so that's good, the archdiocese has the Hispanic Justice Ministry. Javier would be a great contact.
He shared stuff when I was at the Alzheimer's.
That's, because he's got all the grassroots contacts, that would be great.
Yeah, you should have to.
So I have a question, it's not all on my, somebody seems to open that, that's what I have here. I just wanted to know, even if you are interested in joining the advisory board or being part of our cancer folks. But the organization we have right there, and the postings are.
I will step back since I'm basically a white person. And an ally, but I will let others, because I think you want to have people in the community represented, but I think it's a great idea.
So you could be clearly. I just get a question, everybody, we want to kind of.
So she had a question for us. Could you repeat the question?
Okay, sure. I was wondering, since we have one advisory board and 30 cancer focus groups, if any of you will be interested in joining, the groups, because the better representation we have, the better we are to do the work that needs to be done.
So, and what does the time commitment look like for that?
Okay, so the breast cancer community partnership, they meet monthly, and it's from 9 a.m. to 10 p.m. The prostate cancer community partnership also meets monthly, and it's from 4 o'clock to 5:30 p.m. 4 o'clock p.m. to 5:30. The colorectal is quarterly, and it's from 1:30 to 5:30. I just came to that meeting earlier. Shoot, I zoomed over here. And then we have the advisory board that meets quarterly, and it's from 8 a.m. to 9 p.m. So,
And if you send me that information, then I can share it with the whole group.
And there's a folks that are here tonight who may have had their own unique experiences, who might be really valuable, to consider that.
so I guess my next question would be, what can I do? And I would like to say as a friend, I don't necessarily have a friend, but as a friend, ally to you all, what can I do to amplify the message? What can I do to, you know, provide you with great resources, but you are the experts of your own community. What can I do to help?
Just continue to bring those resources for the community and, get those resources handled. I think that would be key.
Is it okay if I contact you all and ask questions? Because you see the work we're out to do, we have connection on our side, like young, African American, but I would like to have my team come out to events that you all are having, or events that are out in the community.
I would say like think outside the box, like all those festivals happening in Florissant and, Benton Park.
So Hispanic Heritage Month in the United States is the 15th of September and the 15th of October, every year. And that's when you see, basically from early September until, what do you call it? You see most of the community festivals.
Yeah.
You can be very busy in the fourth quarter.
In June, we're gonna start the first festival, for example.
Florissant's in June.
The very Sunday,
We have a meeting on the 29th coming up for all the Hispanic leaders, different organizations. I can extend an invitation. we would like to continue. It's the Hispanic, program, but it goes to Hispanic leaders of each communities, in each, association. Like, I mean, it's there, myself,
Oh, okay.
a bunch of other.
Hispanic Heritage, no, Hispanic Inc., that one?
And you may be able
No,
to.
I think it's run through the festival.
Festival.
Yeah, that's Hispanic, but
That'd be good. I would say about the band, you have to schedule like a year in advance.
Yeah.
Because it's hard to get, like, we're lucky, Athenia is lucky because they are always on the schedule and there's a guarantee that they will be coming.
But can Amelia lend it to them, or take it over there?
We fill it up. So then it's sort of like robbing Peter to pay Paul kind of thing. So then there'd be people not getting the service somewhere else. So what I think the interest is that there needs to be more.
Right.
yeah, and bring fun stuff shows.
Bands.
So for perhaps scheduled for the following year, if you do it now, is where for the 2024 session.
Because there's people already scheduled.
And if you are prepared, you send out invitations saying, hey, we're going to.
Well, and if you have a table and you said, we're gonna be here next week, and this is, this is.
Something we did, not long ago with Archwell, Oregon Society, we sponsored an event for mammograms, leading exams. What we did is we contacted Archwell, and with Archwell, we got a mammogram trailer thing, and we have like tables inside the Archwell facility for selling stuff, and then we're like nurses and stuff there, or they get free orientation and exams. But it was a pretty successful event. We had a lot of people coming in. So those are things that you can do.
And also like a demonstration of how they, like, fake, but like how they fit test works.
Yeah.
Why is the HPV vaccine important?
Demystify, like, just get over.
Yeah.
People for.
Like, some people think sometimes the vaccine is gonna give you something to see. So it's like, you know, the HPV vaccine is not gonna, right, cause.
So May 6th, we got with another organization, Latino Roundtable, Southwestern Illinois. We have our Hispanic Festival and Health Fair. I'll put you in contact with Mercedes Collado. She works at SIHF. So we call it Hispanic Festival to not scare people, but it is a health fair. You know, then we bring the Zumba people and, you know, and little prizes and things.
You know what to expect.
But so that community is unique because they know they trust us there. We just had our big, there's like 1,000 people at our Easter egg hunt and all these vendor tables with doing, Molina Healthcare was there and, you know, the DHS, the Brown Health Human Service for Illinois. So that's another way to approach a free program. Hey, you might get, like, what I've learned is you get a booth, you might get 1 or 2 families signed up, and that's a win, you know, because then they'll tell their cousins that this was successful or that their experience. So I can put you in touch, and I'll get your card with Mercedes and Kristen, they're in charge of that. Maybe it could be someday you get out and just information about your program. So,
You can get the kids to the table.
yeah, we
That's
will.
on learning now.
Pressure your parents
People are
to-
not-
No, like, if you bring toys for the kids, they stop by your table, and then like, you get them a burger. Yeah.
And you can invite some of the Hispanic leaders to go there. Gotta get the people in, you
Oh,
know.
yeah, absolutely. As volunteers, we volunteer for that stuff, so.
I would love to have volunteers.
I would love it.
So what's the program, just a basic title of your program, so I could send you
That's the name of that's PCAD, Program for the Elimination of Cancer Care.
program for the elimination of cancer risk. Okay. So I'll do that email intro, and I think they would love that. Because I know Simon does both sides of the river.
Right.
Okay.
All right, everyone, you need to, respect people's time.
Thank you very much.
Thank you. I think this is the start of a great relationship. And I'm the type of person that likes to hold up to my end or if you will see me again. You will see me certified. excited, and I'm happy that this is a place where I can come and really just truly be authentic about the work that we do. And I'm really, really committed to helping the community do the best that I can do to represent like. So, you know, babe, I deserve it.
She has a question.
No, I just wanted to say, I'm sorry that I came in late, I wasn't able to work fast enough, but I'm brand new. I actually am over from the Illinois side. I live in Belleville, and I have an associate's degree, and I work as a paraprofessional at a special education school. And I just wanted to, I'm Honduran and wanted to reach out more.
Guatemala. See you right there.
So yeah, my name's Marisa, by the way.
Marisa,
welcome.
Yes, hope to see you again.
Oh, I'm always over here doing things. Yeah.
Once you go over there,
Okay.
you go.
Yeah.
Yeah.
Can you make sure it's on that student person?
Yeah, I don't know. I'm brand new.
Oh, I was.
Because that's who I am. I'm a. You do something.
No, well, welcome, so we're.
It's by, yeah, it's on there.
So, race, college.
So, yeah, with different rounds of nineteen.
Oh, okay. Yes, ma'am.
So, yeah, and so we post, here digital equity here typically. And speak about, and it's also networking opportunity and stuff.
Same thing.
So please come. So I can get your information, that way we can, hear you.
Yeah, and it's funny because a lot of the offices that I end up doing are.
Professional. How many days?
Yes.